All right. I know you guys, I know you love a good drama story here. Not to make light of this, but it's always interesting to hear these crazy outcomes in plastic surgery. And this one was pretty wild, and it came from?
Lowrider.
Absolutely right. So this is a segment about a lady who says she had a nightmare facelift that left her blind in one eye. As we stated, this
She looks pretty scary.
I know, that patch. I would do like if I had to wear a patch, I'd get like one of the pirate ones, like the black one,
Yeah,
like
that one looks really
I don't like that one.
Sketchy, handmade.
Yeah.
She needs to elevate.
This actually happened back in February. A patient went, and it didn't name the surgeon, which was really weird, went to a unnamed plastic surgeon or cosmetic surgeon. Not sure if it was really a plastic surgeon. I think it probably was not, but we'll get to that. And had a facelift. And this is where the story gets confusing. The details were not great, but the lady basically says she woke up and couldn't see out of one eye. And I was like, that's really odd. Like, what would cause blindness in a facelift? Now, I know you guys probably don't have the kind of background to know that a facelift really doesn't mess with the eyes at all. In fact,
I would assume it wouldn't.
Yeah, I mean, in
unless
fact,
you do like the eyelid surgery.
Right,
with
in
it.
which they specifically said that she did not have eyelid surgery, because that was because a lot of times people will do a facelift and eyelid surgery at the same time, as we talked about in the
doesn't you said
Yeah.
doesn't facelift go right
Yeah,
here?
so the incisions are around the ear for facelift, and you do dissect towards the eye, but at least I and most people leave about a 2 centimeter gap from the corner of the eye to the furthest part that you would do dissection. So you're like really, really far away from the eye. So I was like, okay, how did this happen? And I was like, well, sometimes surgeons will do fat grafting, when they do facelift, and like, is it possible that some fat cells got into the bloodstream and got to the blood supply to the eye? I mean, that'd be very unlikely because that comes from the carotid artery, which is, in the neck, and it does go up here, but it kind of goes into the skull. And I was like, I can't really imagine how that happened. So I'm reading this and I'm just like, well, how did this go down? Well, it turns out that the issue, at least from what I gather from this lady's story, is that she had extreme swelling of her eye, which would be weird for facelift. I mean, I've done some facelifts where people really swelled up, but generally it's the face, not the eyes.
Yeah.
And the issue is that she couldn't close her eye, and her eye dried out, and she got a really bad corneal ulceration, which absolutely can, blind you, at least temporarily.
Oh, so she didn't like wake up from surgery blind. She just woke up from surgery with her eye swollen and she couldn't shut it correctly?
Yeah, I think that's probably what went down, is she had some really severe swelling reaction. Her eyelid swelled shut, and then when the swelling started to go down, it didn't close properly, and then it dried out and she got this corneal ulceration. I'm guessing. Like I said, the details are a little sketchy.
Just like her eye patch.
Exactly. But now she's still months out, and she says she can't really see out of her eye. I guess she probably has got some scar on her cornea, and it's affecting her vision. And this is where the story, gets kind of really sketchy. So she was considered suing her surgeon, and her surgeon doesn't carry malpractice insurance. And we just talked about that, what was it, like a month or so ago, about, I didn't know that this was a thing, to be honest. I just blew my mind to hear that there are, I'm going to put in quotes, plastic surgeons that don't have malpractice insurance. And, with all these stories, we talk about them not to sensationalize it, but like, what is there to learn from this? Like, as you as a patient, what can you learn from this lady's experience to potentially have a bad outcome? And I think there are a couple of things here, and these are things that we have talked about at times in the past. Any surgeon who doesn't have malpractice insurance is an absolute no-go. I mean,
up to no good.
Honestly, like, there is no excuse whatsoever for a plastic surgeon not to carry malpractice insurance, and it is a huge, huge red flag, because it means one of two things. It means that, one, they're a plastic surgeon who's had a lot of bad outcomes and has been sued before, and just like car insurance, because they have a lot of claims, the cost goes way up and they can't afford it.
Right.
So that's one possibility. Good.
So for malpractice, like as a surgeon, wouldn't you have to be considered, like, how some of these people are like general doctors and they're not even real surgeons. So it's like they can't even get malpractice surgery insurance.
That would be the other reason. Yeah. The other reason I think that people might not carry malpractice insurance is they can't be insured because they're not actually a plastic surgeon.
They are. Yeah, so maybe that guy that did that wasn't even a real surgeon because we can't even find him.
That's exactly right. That's what I was thinking. Now I don't know that. These are just like we do know he didn't have malpractice insurance.
We're just going to assume what we assume of Florida.
Right. But yeah, it's a huge warning flag if your surgeon doesn't have malpractice, and it's a shame that you even have to ask these questions. There is one quick way to know if they have malpractice insurance is, are they doing the surgery in a accredited surgery center?
Yeah.
Because I cannot go and operate a surgery center, or a hospital for that matter, if I don't prove that I have malpractice insurance, which means that this was done, in an office. This was an office-based surgery. I've talked about office-based surgery before. I'm personally against it, and I'm going to say that I'm sure, and I know that there are some very good, skilled, careful plastic surgeons out there who operate out of their own offices. However, that being said, when people are operated on in an office, there is not that oversight that is present in a surgery center. So for example, like you can operate without malpractice insurance in your office. Yeah. You can do procedures that you're not trained to do in your office.
There's a bunch of gray areas.
Yeah, it just opens up the potential for some
like pretty much unnecessary risks, in my opinion.
Yeah, I mean, like I said, I know plastic surgeons out there that have their own offices that are great surgeons, and they're very safe and they're very good. But on the other hand, you can't get away with a lot of bad things in a surgery center that you could get away with in an office. And as a patient, it's hard to know who's who.
Yeah.
And so, I'm not saying that it's a bad idea to get plastic surgery in somebody's office OR. However, you need to make sure that they're legit. Yeah. Right? That they are a board certified plastic surgeon, that they are carrying malpractice insurance. Of course, then we always talk about, we've heard those stories about, remember the girl that had cardiac arrest during the surgery and they refused to call 911? There's been a couple of those actually. Like you can get away with that in an office OR. You cannot get away with that in a surgery center. So definitely. I don't know. I mean, it's, like I said, I have friends who have office ORs, and I'm not trying to poop on them or anything, but but there is a extra level of risk involved with doing office surgery versus surgery center surgery. Yeah. Yeah. And so I think those are things to learn. The more education people have and, the more knowledge they have, I think the more likely they are to avoid, some bad outcome like this. Yeah. Because, there's definitely some sketchiness going on in this story. I mean, the fact that, why did her eye swell like that? That's not something that should happen with surgery like this. She got some
pink eye and
she had monkeypox in her eye.
Yeah, she got some pustules in there. I don't think so.
But hopefully she'll get her vision back. I think it's something that can be fixed. In fact, the lady in the article was talking about how she's been talking to a
that picture looks old though.
It's just not a great,
like it's from like the 80s.
Like from the 80s. Throw it back up there, Travis. Does it look like it's from the 80s?
It looks like an unsolved mystery picture.
Yeah. Like.
Oh my God, you guys are killing me. Yeah, I agree. I think part of the problem is like I pulled that image off of like a news article, and like it's just not a high quality image. I don't know why she's wearing that. Maybe that's like a dressing that she's doing. But she does have like her makeup's like on point and stuff. Right?
Absolutely.
She just wants, I don't know. It just makes me laugh. She looks like she'd be the type of woman, like how her makeup's done, like she'd have like a pretty eye patch.
Like it all blinged out.
Like with it like maybe monogrammed or something, you know? Like that's the way she did her makeup makes it seem like that. But no, she has like this eye patch that looks like she like went to CVS and just like put tape all over.
I think if
her
I like
face.
Lost an eye, because now you can get like glass eyes, like, say your eye goes out and like it, I don't know, withers or something. Like, I think I'd probably just get a patch. I think that'd be kind of cool.
Yeah, and just have that
rock
persona.
The patch. Like, isn't there like a famous politician with a patch? Like he's like I think he's a Republican guy, right?
I know who you're talking about.
Crenshaw or something?
Yes.
Is that his name?
Yes.
I don't know where I came up with that.
I follow him on Instagram.
Oh, really?
I think.
Yeah. Isn't he from Texas?
I don't know.
I don't know.
I don't know if I don't know if, I think I do, but I don't know if I muted him. Sometimes when they get too obnoxious about stuff, I just tend to mute them.
I'm about ready for the election to be over, man. It's just like constantly just force fed to you about, I'm ready for it to be done. However it goes, and just be glad it's over. Yeah.
Me.
All right. I think that's all the time we have for today. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Hit the notification button too so you know when the next videos come out on Nip Talk. Thanks.
Bye.
Bye.